If you know say you get fibroid or you dey suffer from fibroid or they don't diagnose you with fibroid, please watch this video. This video go help you to understand everything about fibroid. Hi, my name is Tochi and you are watching Tochi Fertility channel. If you like what you are seeing, please like, subscribe and follow our page. Before I proceed into this video, I want to put a disclaimer that I, Tochi, am not a professional. I'm not a medical practitioner. If you have any issue regarding your health, your fertility, endeavor to visit your physician, your gynecologist, your healthcare provider. I am a very good researcher. I study hard. So after studying, I try to impart knowledge on women trying to conceive. So in today's video, we are going to be talking about fibroid and the type of fibroid so that you will know the one that is affecting your fertility. A lot of people, when they are diagnosed with fibroid, they are always afraid. Oh, am I going to become pregnant again? Oh, am I going to give birth again? You need to understand what fibroid is, the types, and the one that can affect your chances of becoming a mother. If this video is for you, sit down, don't rush, and watch. Now, what is fibroid? Fibroid is a tumor that is not cancerous. It is not cancerous. Every woman under the reproductive age have fibroid. For the fact that it's not giving you symptoms doesn't mean that you don't have it. Every woman have fibroid because you are still, in fact, the first important or signs of fibroid shows that you are still under the reproductive age. Once you clock menopause, you will not have or develop any fibroid because your estrogen will go down. Fibroid feeds from estrogen. Now, we have three types of fibroid. I want you to pay attention so that you will know the one that you are suffering from and the one that is affecting your ability of conception. 1, we have subserosal fibroid. 2, we have intramural fibroid, and 3, we have submucosal fibroid. Now we are going to be looking into what these types of fibroid are, their function, and how they can prevent or support your ability of becoming pregnant. So, subserosal fibroid, this fibroid grows on the outside of the uterus. Subserosal fibroid grows outside your uterus. They don't cause many issues with the reproductive system. However, they can cause other symptoms as they grow and compress the surrounding organs like the bladder. This type of fibroid, I'm talking about subserosal fibroid, the type of fibroid that is growing outside your uterus, outside your womb. Whenever you hear uterus, it means your womb. So this type of fibroid doesn't really cause problem in your reproductive organ because they are outside. That is why anytime you have been diagnosed with fibroid, if you have gone to your doctor or your physician or your healthcare provider or your fertility doctor and they diagnose you with fibroid, please endeavor to ask them what type of fibroid. If they say subserosal fibroid, you don't know what it is, ask them, please, what is subserosal fibroid? Then they will be able to explain to you that these fibroids are the ones that grows outside your uterus and they will not affect your ability of becoming pregnant. Immediately, some people are told that they have fibroid, they start shivering. Oh, I hope I'm going to become pregnant. You need to find out the type of fibroid. That is why it is very, very important for you to always be in good terms with your physician. Go to them. They will conduct proper tests and find out what you are suffering from. Don't guess, don't assume. Stop going to the places that is unprofessional. That is why these doctors are there for you. Please make your doctor your best friend. Now we have talked about subserosal fibroid, which I said that is the type of fibroid that grows outside your uterus and does not cause any problem to your reproductive system, which means it doesn't prevent you from becoming pregnant. However, it can develop other symptoms by pressing on your bladder, which may be making you to be urinating, but it is not really serious when it comes to fertility. So number 2 type of fibroid is called intramural fibroid. This occur or this grows in the wall of the uterus beneath the endometrium. Mural fibroid can affect the function of the uterus and the surrounding organ. This is the one that can cause problem. It can cause heavy period, back pain, frequent urination. They grow at the front of the uterus. They grow at the front of the characteristic now. They grow at the front of the uterus. They are lying under your endometrium. These are the place that the new fertilized zygote supposed to implant. They are just taking the position, the place, and this will cause heavy bleeding, frequent urination, and all that. So intramural is the type of fibroid that can affect your ability to conceive, because it can cause problem to your reproductive organs. Anything that causes problem to your reproductive organ can affect your chances or your ability of getting pregnant. Are you people hearing me? The first one I talked about, subserosal fibroid. This one grows outside your uterus and it causes any problem to your reproductive organs. So the one I talked about, intramural fibroid, the one that I told you that is lying beneath the endometrium, and it also causes problem to your reproductive organ. So number 3 now is submucosal fibroid. Submucosal fibroids are the rare type of fibroid and often the most problematic. They grow underneath the lining of the uterus, which is known as the endometrium. This is their father. This is the one that makes trouble. This is the highest of it. Mucosal fibroids, they are always rare. It's not many people that suffers it, and they are the one that often cause problematic. They grow underneath the lining of the uterus, which is known as the endometrium. So mucosal fibroid can cause trouble with fertility. Do you know why? Because they are lying at the endometrium. Endometrium is a lining whereby the new fertilized zygote is supposed to implant. So what they do is that they go and grow there. It's just like you, if you're a farmer, you want to plant a crop, and when you go to the place that you're supposed to plant something, you'll notice that somebody or something is growing there. So you need to push that thing away for you to implant your own. This is why it is causing problem. People with this type of fibroid, they always find it difficult to get pregnant, because sometimes it may lead to their tubal blockade. Sometimes even if they become pregnant with it, they will continue to have series of miscarriages. So mucosal fibroid can cause trouble with your fertility. The fibroid can distort the uterus and other reproductive organs such as fallopian tubes, making it difficult for a person to get pregnant. Anything that is leading to your tubal blockage is causing infertility to you. So I know the reason why I am talking about this is for people to know, to have knowledge that it's not every fibroid that is threatening to your fertility. So when you are diagnosed with fibroid, please try to ask them the name, the size, the position, whether the fibroid is inside or outside. If it is outside, you don't need to worry. It will never prevent you from becoming pregnant. If it is inside, the next thing is to find out the size of this fibroid. So you shouldn't be afraid, or you shouldn't base on what people tells you, but rather conduct research, go to your physician, whatever he tells you, follow his footsteps. And I often hear people, they'll always say, what can we take? What can we do? I have uterine fibroid, I have this, what can I take to? Please, always follow your doctor's instruction. And the best way to avoid fibroid is by stop eating the food that promotes the growth of estrogen. Fibroid feeds from estrogen. So I think I will stop here. If you need further questions, go to your gynecologist. So like I said from the beginning of this video, I, Tochi, I am not a professional. I am not a medical practitioner. Everything that I'm teaching here, I am a very good researcher. I study a lot. So when I get this knowledge, I try to impart it to my fellow women who are trying to conceive, who are ignorant about their cycle. So if you have any issue regarding your health, your fertility, my sister, go to your doctor. And I believe you learned something from this video. If you do, like, follow, subscribe, and ask your question in the comment section. I will answer you. I love you. You that is watching me. Yes, I love you. Bye-bye.